On this side of the stage, we've got Dave Corrigan, Director of Informatics from Lumeris. Lumeris is trying to make sense of all the data that exists in accountable care organizations or the new payment model organizations. Dave? Oh, came over here.
Oh. Thank you very much for that introduction. And don't worry, I'm acutely aware that I am the only thing keeping everybody in the audience from the Datapalooza that starts in a few minutes as soon as I'm done. So with that being said, my name is Dave Corrigan. I am in informatics at a company called Lumeris. We develop technology solutions for accountable delivery systems, and we use the term accountable delivery systems to describe hospitals, provider organizations that are taking risk and accountability on behalf of the population that they serve, so they're managing the cost and the quality of their population. So let me be the 25th person to tell you that the cost of our nation's healthcare is the most expensive in the world, and that those costs are not even, in correlation with good quality outcomes like life expectancy and other outcomes. So with that being said, what I haven't heard today, though, is a discussion about why we have this discrepancy between high costs and mediocre quality. And it has to do with the underlying economics of our healthcare delivery system, where historically speaking, hospitals and physicians have been paid for the volume of services they provided and not necessarily on the value, the outcomes they achieved, but that's changing, and it's changing in a rapid way with this movement towards accountable care. It's also changing in such a rapid way that it's really scaring a lot of hospitals, a lot of physicians out there who are a little bit anxious about taking risk. They're a little bit anxious about being held accountable because they never have been. And not only that, but they have short memories. And they remember from the 80s and 90s that this movement towards accountable care, this ACO acronym, it sounds a lot like an HMO, it sounds a lot like managed care, and it also sounds like a lot, it reminds them, this sounds like a new way for me to lose my shirt, which doesn't necessarily have to be the case.